our final speakers are Ms. Kaye Borgelt, Dr. Adam Craig, and Ronny Samuel Tuvalu. Kaye Borgelt has for many years worked as a health information consultant from her home base in rural Victoria. She's passionate about building IT systems that support the accurate, timely, and comprehensive collection and transfer of health data, and the translation of these data into useful information to improve health outcomes. In 2018 to 19, Kaye spent 12 months as a volunteer health information manager in the Pacific Island paradise of Tuvalu, where she supported the implementation of the VSAT system. So now I'm going to introduce Dr. Adam Craig. He's an epidemiologist and a global health and health systems researcher at the University of New South Wales, Sydney. He leads work for the World Health Organization Collaborating Centre on eHealth, is University of New South Wales academic lead to the Asia Pacific Observatory on Health Systems and Policies, and is Assistant Director of the university's Bachelor of International Public Health program. Wow, he does a lot. Adam's research seeks solutions to the development, resourcing, and systems challenges that inhibit the collection, exchange, and the use of health data for policy and program decision-making in low and middle income settings. And finally, Ronny Samuel, who heads the Information, Communication and Technology team at the Tuvalu Department of Health. In this role, he oversees the government's digital health development, including the networking of remote health facilities through satellite communication systems. He's dedicated to using his IT skills to support all of Tuvaluans' health. We're looking forward to hearing your talk. Welcome.
Thank you very much. I'm sure that, let me know if you can't hear me, but I'd like to start by acknowledging the Bedigal people on which the University of New South Wales campus lives or is built, and to respect elders past and present. Thanks to everyone for inviting us to speak and to talk to you about our work in Tuvalu. I'm presenting today with my two colleagues, Kaye Borgelt, as you just heard from, who led the research component of this work, and Ronny, who is the formidable and amazing person who does all the ITC development and that we'll talk about in our speech today. Let me share my screen when I work out how to do that. How does that look?
Yep, looking good.
Just make it full screen, hang on. There you go.
Yep, wonderful, thank you.
That's all good. Excellent. So our talk is about digital health in one of the remotest parts of the world, in Tuvalu, and how it's really revolutionising the way that healthcare is being delivered in this island nation. And this beautiful picture here is of the lagoon in Tuvalu, and you can see in the very distance there, the water becomes dark blue. That's the Pacific Ocean, or all the Pacific Ocean, but that's the deep Pacific Ocean. This light blue, beautiful colour is the lagoon that the Tuvalu atoll sits around, or one of the Tuvalu atolls sits around, and that boat's a traditional power canoe, outrigger canoe that's from the islands. So in today's presentation, we've kind of broken up this way, and we're going to sort of switch between us, but really to start with talking about the Tuvaluan context, with an appreciation that perhaps people who are on the call don't fully appreciate the development status and the context in which this work has been done, and then talk about specifically what the challenges are that the digital health solution that we're going to talk about, VSAT, has helped or has stimulated the implementation of the VSAT system, and then the impacts it has, and then I guess looking at Tuvalu as one Pacific Island country, or one low resource Pacific Island country, and how the work that is coming out of Tuvalu might influence other Pacific Island countries. So over to you, Kaye. I'll let you take over from for this first bit.
Thanks, Adam. So where on earth is Tuvalu? And you can see that dot literally in the middle of the Pacific Ocean is the beautiful island paradise of Tuvalu. And for those who may have ever been to Hawaii, it's about exactly halfway between Australia and Hawaii. So on to the next one, and I'll give you, so the country of Tuvalu is made up of 9 different islands, and it actually covers a huge geographical space, most of which is the South Pacific Ocean. It's the 4th smallest country in the world. There are prizes for knowing what the first 3 are, and one of them San Marino, and the other one is the Vatican, and I can't even remember what the other one is. It has a population of nearly 11,000, 10,645 is the exact number in the 2017 census. Of that, more than 6,000 people live on the main island of Funafuti, which is where the hospital is located. It has a total size, the 9 islands. So to access the 9 islands, the shortest journey is about 6 hours, and the longest journey is 22 hours. And the only way to get to any of those islands is via a boat. None of the islands, apart from Funafuti, have an airstrip, so it's absolutely by boat. It's one of the most at-risk countries in the world in regard to climate change. At its highest point, it's 3 meters above sea level. At its lowest point, it's right at sea level. And so while we talk about floods and bushfires here in Australia, the reality for the people of Tuvalu is that their entire country will most likely be underwater by the end of this century. The total land mass is 26 square kilometres, which, as we say, makes it the 4th smallest in the world. It is a proud member of the Commonwealth, and for any people that are royal watchers, Prince William and the Duchess of Cambridge actually visited on an overnight stay back in 2011, which was certainly a highlight for Tuvalu. It was a British colony up until 1978 and was granted independence in 1978. And so they have a very proud democracy. This is the island of Funafuti, which, as I say, is the main island. 6,300 people live there. It's 11 kilometres long, and at its widest is 800 metres wide. So if you go to live in Funafuti, you are pretty much guaranteed an ocean view or a lagoon view. At its narrowest point, it's 10 metres wide. So there you have a photo of the ocean on one side and the lagoon on the other side. So anyone looking for a sea change, there you may wish to be. Tuvalu is a developing country. It has very dodgy telephone access to the outer islands, and to the hospital there is one line in and one line out, which was at its best very, very dodgy. The internet, when it's available, back when I was there in 2019, was incredibly expensive. So for 2 gigabytes of data, it costs 20 Australian dollars. And the average income for a Tuvaluan is about $9,000 per year. So that gives you some idea about just how difficult communication is in regard to trying to use the internet and for people to actually be able to afford it. Positive is that most homes have electricity and flushing toilets and are connected to rainwater tanks, although there is no natural water supply in Tuvalu, so you are totally reliant on what falls out of the sky. While I was there, we had a drought because it literally didn't rain for 2 weeks straight, so people then had run out of water. This is climate change at its best, a child playing in the water. That's after we've had a super king tide. So because it's built on a coral atoll, the water actually comes up in the middle of the island, which is quite an amazing thing to witness when you see a king tide or a super king tide. Some quick and fun facts about Tuvalu. It is a developing country. It has much poorer health outcomes when compared to Australia across a whole range of World Health Organization key performance indicators. And it's worth noting this is one of our nearest Pacific neighbours. And when you look at the infant mortality rate of Tuvalu compared to Australia, I think there's something there to be said in terms of equity. And I know that's the conversation that we're having today, is about equity, and maybe as a very rich first world country, we have some responsibility in regard to trying to improve equity, health equity for some of our nearest neighbours across the Pacific. Tuvalu has a truly universal healthcare system. So there are no private practitioners in Tuvalu. Everything is run by the government. There's one hospital. It has 50 beds. It has an ICU, but the ICU just means that it has an air conditioner in the room and the other wards don't. There are 12 general doctors and 3 specialists. As anyone who's lived and worked in remote Australia knows, if you want to retain skilled practitioners, you must much better off to upskill your local people. And in Tuvalu, it's no different, except that the Tuvaluans, to go off and become qualified doctors, leave home at the end of their Form 6. They travel to Cuba. They learn to speak Spanish. Then they do their undergraduate training. And may in that time get to go home to Tuvalu once in that 7-year process. Those doctors then come back, do a year internship in Kiribati, and then come back to man the hospital and everything else. So it's a pretty amazing effort that these doctors do. There is very limited access to equipment, including your diagnostic equipment. They have an X-ray machine. They have basic pathology. There's no radiologists. There's no pathologists. And in terms of equipment, at one stage while I was there, the boat didn't come because of the cyclone. So the boat takes 6 weeks to come from Fiji, to give you some idea. So we actually had to cancel any sort of surgery for 3 months because we ran out of anaesthetic. And we had to maintain, when we had to keep what we had to do any emergency surgery, which mainly meant lower uterine cesarean sections, which were considered the emergencies. Also, we ran out of gauze, so we were down to using honey honey on chronic wounds, which was a pretty amazing sort of thing. On each of the outer islands, we have a health clinic, which is staffed by a registered nurse and a sanitation aide and maybe a nurse aide as well. So we have a pretty basic healthcare system in Tuvalu. The challenge then was, how do we go about trying to improve this? Because really, if you were out on the islands, you were on your own. The other thing worthy of note is, because the hospital is really only what we would call a secondary centre, there is an incredibly high number of overseas medical transfers. So anyone requiring anything more than basic surgery has to be transferred over to either Fiji, India or Malaysia. Interestingly enough, they don't come to either Australia or New Zealand because the care is too expensive. So all in all, overseas medical transfers accounts for nearly 60% of the national health budget, which is amazing, because the Tuvalu government pay for everything while people are overseas. Their accommodation, their food, their care, it's all paid for. The air flights. So just to give you some idea, before COVID, there was 2 or 3 flights into Tuvalu each week. So it is also one of the least visited countries on the planet. Sorry, Adam. So the challenges of living and working and trying to improve health in Tuvalu. We have a really small population spread over 9 islands. there was a really limited capacity to provide service just because we didn't have the communication and the capacity for communication between the islands. There was a real lack of mechanism for peer communication and data exchange. As a health information manager, to give you some idea, to get 1 page of summary of health statistics, it had to come on the boat. The boat only goes out to each of those islands once a month. So that's how you got information, was via the boat. So really failing to meet the universal health coverage because we cannot really provide access to care when and where it's needed without undue financial pressure. So the introduction of the VSAT technology communication has helped to access clinical decision-making support, because now the nurses at the outer islands can actually get hold of and speak with a doctor on Funafuti in real time. It's helped in terms of ordering stock and supply, both into Tuvalu, but also out to the islands. It's helped with training and education. We can, for the first, well, not really, but we're trying to be able to share medical record information. And Adam has moved me on. So I'm now going to actually hand you over to Ronny, who's going to talk about the solution and what VSAT has done. Are you there, Ronny?
Yes, Talofa again from the beautiful island of Tuvalu, and yeah, I'll present to you the solution, the VSAT that was introduced by the Ministry of Health, and we started back in early 2020 when the COVID lockdown, and then we managed to take in an engineer from Fiji to fly over and to train me here in Funafuti to start the installation, and the engineer need to go back to Fiji, and then I left to travel by myself to the islands to install the satellites. Before that was I mean, the clinics were using we have a radio, so it's kind of like what Kaye say, it's very difficult to communicate with the main hospital. So it's, the ministry decided to buy the VSAT to make communication much more easier for the clinicians and the nurses in the highland. So we have to travel by boat, load all the terminals onto the boat, and then travel to the island. The boat only went to the island once in 2 weeks or once in a month. If it's bad weather, I have to stay there for more than a month before coming back to Funafuti. So during the installation, we have to install the satellite in the clinic. We have to look for a place to align it well with the satellites. And some of these places in the island at the clinics, we have to find a best spot to put the post, because Tuvalu is sea level rise, and when you dig up the post, it's only up to less than 3 meters. In some areas, you already just see the seawater is already up. So we need to find a best spot to put it up. This is some of the challenges. Once we put it up, and then we're trying to do the installation in the island, and all of a sudden in the islands, they're using solar and generator, and sometimes when the power is down, and then we have to stop what we are doing, we wait for the power again, or we wait for when there's bad weather, we don't do our installation. We have to wait for the sun when it touches the solar, and then we started our installation again. So after the installation, we need to train the nurses in the island. So need to teach them. Some of the nurses were in the island for quite some time, and by using computers and using like going on Zoom, it's very hard there. So for them, so I need to do some basic trainings, some how to log in into WebEx, or how to log in into Zoom, connect them to the main hospital, and then also connect them to some of our referral doctors in India or in New Zealand or in Fiji. So sometimes they kind of like really scared to click on the mic or on the video. So I have to walk them through on how to use the Zoom or WebEx. So if the camera is down, I need to, because in the island, when I need to teach the nurses on how to use it, because there's no IT support in the island in the clinic. So the nurse themselves, I need to teach them basic computing on how to use the computer, on how to turn on the Zoom and connect to the main hospital in Funafiti. So these are some of the trainings I have done with them in the islands, and also during the COVID, this visit really helps a lot to connect with our trainings. Most of the nurses were in the island, and they're using this to upskill their training, our CMEs and CNE. So the visit really helps a lot with the island clinics.
Thanks, Roddy and Kaye. It was a great introduction to the context and to VSAT. I'm going to take over now and just talk about the research component that we led on the back of Ronnie's work in Tuvalu with VSAT. Before I do, sorry, I do apologise for flicking around screens. It's not as, for some reason, it's not as straightforward as one would expect, including now. Okay, we can go back now. So just for those that aren't familiar, what VSAT is stands for Very Small Aperture Terminals. So it's an acronym which doesn't mean anything really. But what it does, it allows, like you and I, we're all plugged into a computer through the Wi-Fi system. So we're down here somewhere. We're in this bottom row in the yellow box, through a Wi-Fi or through a LAN network, modem, and then we go to the NBN. Tuvalu, the modem is linked to one of those satellite dishes that Ronnie showed. And then that beams up through a satellite and back to a master station somewhere else in the world and accesses the internet that way. So, it's basically making health facilities Wi-Fi hotspots. Yeah, slow, but revolutionary, and we'll discuss why in this section of what we found. So this work really, the research component of this work really came about through my conversations with Kaye, and kind of the passion that came through about, wow, what's happening in Tuvalu is amazing, and this simple tech investment, how it's revolutionizing the way that health workers are going about their business, but that was going to be lost. So both in Tuvalu, in the sense that people weren't necessarily writing things down and reflecting on the great changes that were happening, and that wasn't necessarily informing policy and practice in the country, but also at a regional level, that the lessons that are coming out of Tuvalu, which are quite unique, aren't being shared with other Pacific Island countries. So we set about to do a small piece of research to explore the impacts that VSAT has had on primary healthcare delivery. And we used qual methods. So we interviewed stakeholders from a number of different stakeholders with a number of different perspectives of the VSAT system. So nurses who are using the system, clinical staff at the Princess Margaret Hospital, and the managers responsible for the decisions around building the VSAT system and maintaining it. And we got around 80% of all users in our sample. And just keep in mind that Tuvalu is small, so the workforce is not huge, and Kaye touched on that. So we didn't have a huge sample size, but it did represent a large, about 80% of all stakeholders. So what did we find? And we found lots of things, and I just wanted to sort of touch on 5 key areas. So perhaps the most transformative impact of the installation of VSAT has been the capacity to relatively easily link health workers on outer islands in near real time with consultants and medical staff back in Princess Margaret Hospital. So previously, as Kaye touched on, the only means of direct communication was through this single telephone line, and that required a whole range of things to be in place. It required the system to be working for a start, and it required somebody to be at the other end to pick up the phone at all hours, and then for that person to be able to go and find the clinician on the ward and get them back to the phone to be able to respond. It just didn't work, and people reported being very frustrated with that process, and as a result, not engaging with that opportunity. So nurses on outer islands didn't use that facility because it didn't meet their their need. What VSAT has done, by simply allowing the phone in their pocket or their laptop or a tablet to be connected to a service like WhatsApp and to be working in groups, instant or near instant engagement directly with their colleagues at the central level. And this obviously allowed allowed health workers on remote islands to be able to consult with their colleagues about the appropriate patient management that was applied. Yeah, so I've got a quote here that one doctor interviewed commented that rather than trying to get a call to the outer islands, now we as doctors just check our WhatsApp group on our phone, and the first one to see a message from one of the nurses on the outer islands just responds. It's much better than before, and we don't have to run around the hospital looking for people or to find a radio to get back to them. So when this first rolled out, the internet was quite slow and it was just messaging, but that's been improved over time. And Ronny, maybe you want to talk about this at the end. But now the upload speed or the transfer speed is about 2. Tell me if I'm wrong, Ronny. Shake your head if I'm wrong. But from memory, it was at 2 megabytes per second. Does that sound right? Anyway, it's fast enough to be able to share images. So this pseudo telehealth is happening by default through platforms such as WhatsApp. But the second point that came out from the interviews and the research was that the capacity to consult with clinicians at PMC reduced the number of domestic transfers that were required. So before, when somebody needed to see a doctor, they would have to get on a boat and go into the capital and see a doctor there. And obviously that takes, as Kaye pointed out, many, many hours, and you've got to wait for the boat schedule, accommodation, et cetera, et cetera. It's quite expensive. With the introduction or the liberation of communication through VSAT, there is increasing application of telemedicine, whether that be through a local healthcare provider or direct with the patient. It's happening on both counts within the country, but increasingly, and it's only early days, but increasingly happening with their referral doctors overseas too. So, this new technology, as simple as it is really just opening up opportunities and possibilities for different models of healthcare. Nurses and health workers talked about this sense of isolation previously. So, you're on an outer island, you never saw your colleagues, you never really got any supervision or clinical training or support. Just through the opportunistic communication backwards and forwards, using WhatsApp and other platforms, the networks and the teams have been formed, and people reported that they were learning on the job through that incidental opportunistic engagement. But similarly, there's been some examples of VSAT being used to deliver formal education. So, for instance, during the pandemic, a Taiwan hospital was providing weekly, or was working with the Tuvalu government and providing weekly COVID briefings and education to all the outer islands. And I've participated in one of those, and it was just amazing, to be in Australia talking to someone in one of the most remote islands in the world and engaging and being able to share information, both ways. It's really revolutionized that sense of workforce, the ability to provide workforce development. On the flip side, the surveys and the work that we did sort of highlighted that the VSAT system, while remarkable in its simplicity and pretty stable, is still really vulnerable to some externalities. So the example that came up most often was that the outer islands rely on generator produced power for their hospital, and that can sometimes run low. So if diesel doesn't get to the island, the generator doesn't run, and people just don't have power. So the VSAT system obviously closes down. Some other things that popped up were that Tuvalu is a coastal country. There's lots of salt in the air. Things corrode quickly. Things require maintenance. So computers break down, connections stop working. Not having a supply chain to support that continual upgrade, or the staff for that matter, to support that continual upgrade, is a real weakness of the system. And then finally, sorry, I can't see it because the screen is over the top. the interviews highlighted that sorry, I'm going to move on. I think I can't. Sorry, of course. The VSAT, while it's addressed to some of the communication issues, it's really just the beginning, and that it's not the panacea, it's not the solution to all of Tuvalu's problems, and it should be seen just as a tool. There's a whole bunch of work that needs to go into, if digital health is going to really kind of be capitalized on in the country, there's a whole bunch of work to go into health information system development, electronic supply chain management, laboratory linked with health records, everything that we kind of take for granted in Australia. So in summary, DSAT has allowed teams to work as teams, which is a real important workforce outcome that, again, we do take for granted. It's reduced costs, direct and indirect, to the health system, but also to the consumer. That it has broadened the range of management, patient management or clinical management opportunities that the health system can offer, and that it has reduced isolation and provided opportunities for remote workers to receive the training and support that they require to do their job well. So, thinking in terms of equity, each of those 4 outcomes, if you like, all speak to reducing inequity across the health system in one of the poorest and most, I guess, disadvantaged population groups in the world when it comes to health. I'll put them up, but I won't read through them. But these 3 themes resonated through the work that we did with the evaluation, and I think speak to Tuvalu's situation, but to digital health development work more broadly in low and middle income countries. So the first one is that technology is not the only answer. It's not the panacea for all problems. It needs to be seen as a tool to support the fundamental development of the building blocks of a good health system. So good financial systems, good information exchange systems, good workforce and workforce development systems, good technology and good governance. So digital health offers those opportunities, but at this stage in Tuvalu, it's really at the beginning steps, and that's the future. In the Pacific context, where delivery of health services is extremely resource sensitive, a digital health intervention must demonstrate, benefit before a decision maker, a policy leader, is going to feel comfortable to jump in and spend their limited health budget on things that could otherwise be spent on other things, such as facility upgrade, provision of essential medicines, and overseas transfers, as we talked about. And that's always a tension in the Pacific. And Ronny, I'll come back to you and you can reflect on if what I'm saying resonates with you too. But leaders who are making decisions about what digital health interventions ought to be implemented or could be implemented are in this bind between, we have to provide primary care, and you saying we need this new tool takes me away, takes budget and takes time and takes workforce away from just delivery of things that I know are safe. So we've got to overcome that through development of good evidence. And then I guess just reflecting that in the past in the Pacific, there's been lots of digital health interventions. And Ray, you said it in your presentation before, those often get up and go really well while the funding's there. But as soon as the project's over or the funding is removed, those projects fall. And I think there's a bit of fatigue. So ensuring that the digital health intervention that are chosen prudent and aligned with contextual realities is really important, but also that those building blocks that support scalable and sustainable digital interventions are in place, and that stuff's really hard. So that's a Tuvalu case study, and I guess I wanted to just point out that this is one country. In the Pacific, there's 23 different countries, all of which face really challenging in contexts in which to roll out digital health. Populations, spread over vast numbers of islands. So if you look at Solomons, for instance, 80% of the population live in villages, less than 200 people. It's not easy to deliver healthcare in those contexts. Only 10% of the population have access to the internet. So these these kind of major hurdles need to be overcome if digital health is going to provide some of the answers to the challenges for in delivery of universal health coverage. I don't put this up to go through it in any detail, but this is work done by Teng Liao, our colleague at UNSW, about digital maturity in the Pacific. And basically, it just looks at 5 domains, or 5 domains, and categorizes countries, or countries categorize themselves from basic right through to innovative. So, from getting right through to highly advanced. And you can see that for the most part, civilian countries fall into the lower end of that spectrum. Just to point out that it's not a unique situation. Tuvalu, this is common across the whole region. This led us to another piece of work that we've just finished and just published, is a policy brief on the use of digital health to support the achievement of universal health coverage in the Pacific context. And again, it's not time now to go into this document, but document is really structured around this idea that, sure, we've got UHC goals and ambitions, and we've got challenges. This is the top, and that's our kind of end goal, is to address those. What targeted digital health interventions are best suited to the Pacific context that can support decision makers and implementers, work in the UHC space? But more importantly, underneath those interventions, so the apps and the information, the health information systems, whatever the application is, what is the architecture, and how can that architecture be developed to ensure that what is implemented will work now and into the future. And again, not to go through this, but as just an excerpt from the report, the way it's been structured is, I think, useful to Pacific Island countries, but potentially to the broader audience, where we've looked at health system challenges that are faced, and what priority digital health interventions might be used or adopted in response to those. So, just to summarize, by enabling communication through VSAT, the Tuvalu health system has definitely been revolutionized, and it is operating in a way that it wasn't able to before. There's lots of low-hanging research fruit, if you like, or lots of questions that will be answered over the coming years, hopefully, which will build evidence to support what impact VSAT has actually had on things like health financing, on service delivery, on quality of care, and other universal health coverage principles. The VSAT in Tuvalu has, provided really fundamental infrastructure that is allowing the Tuvalu government to leverage other essential services for healthcare delivery. Things like supply chain management, as an example, is now liberated because facilities can now talk to each other, or patient data exchange and medical records exchange can now happen because there is some platform for communication. As we've talked about lots of times, digital health is a tool, not a panacea for all issues. And really, if we're serious about sustainability and scalability, not just looking at the intervention, but looking at the architecture that sits underneath that is critical. I really like this photo. It's the, if you see those 2 things on the wall, this is the laboratory in the main hospital, and their colleagues working with others from around Tuvalu, but also from other countries, from Taiwan, I think it is, to do an education session using the VSAT system. And it really just speaks to me, anyway, the revolutionary impact this intervention has had. So thanks to the Tuvalu Ministry of Health, and to the Asia Pacific Observatory for Health Systems and Policies that supported this work. We have a few publications coming out of this work, something which we hoped would be up for this meeting, but it's almost there. We've got a DOI number for this article, which should be coming out in the next day or 2, reporting the work of Tuvalu, the policy brief, and then next to that, a short summary of that policy brief, a 3-minute video summary, and then a few other pieces of work people may be interested in, and can contact us if you'd like to have a chat about anything. Thank you very much.